Namaskar. If you're here listening to us today, chances are you're like us, a farmer right here in Harkund, working hard every day to make ends meet.
Exactly. And we all know what matters most. Family, the land we work on, and of course our animals.
That's right. Our cattle, buffalo, sheep, goats, pigs, they're practically family, really.
They are. They're a big part of our lives, and let's be honest, they're our future too.
So today we're diving deep into something that affects all of us here. The diseases, the sicknesses that can trouble our animals.
We're going to break down livestock diseases.
Making it simple, making it useful for everyone here in Harkund.
We want to make sure you understand what these diseases are, how to recognize them, and most importantly, how to keep your animals healthy.
And what to do if they do get sick, right?
Exactly.
So we'll talk about what disease actually is, the different ways it can show up.
The common ones we see in our cattle, buffalo, sheep, goats, and pigs right here in Tarkand.
And we'll give you practical advice. Real things you can do on your farm to prevent these diseases.
And to deal with them if they do happen.
Okay, so let's get started. Let's talk about what disease actually is.
Well, in the simplest terms, a disease is when an animal's body isn't working the way it should.
It's like when we have a fever or a stomach ache.
Exactly. It means something's not right. And for animals, it's often caused by really tiny things we can't see.
Germs, right?
Yes, germs. We call them pathogens. They're these tiny invaders that can make an animal sick.
Tiny but mighty troublemakers. The book talks about two main types of these pathogens.
It does. First, there are what we call pathogenic organisms. These are the real troublemakers. If they get into an animal, they always cause disease.
They're like guaranteed trouble.
Yeah.
Every time. But then there are also, facultative pathogens.
Right. Now, these are a bit different. These usually live on or in the animal without causing any harm.
So they're just kind of hanging out, minding their own business.
Exactly. But, and this is where it gets important for us as farmers,
Okay, here's the catch.
if the animal gets weak or stressed, these usually harmless germs can take advantage.
So if the rains are bad or the weather's harsh,
Or if the grazing isn't good, these germs can suddenly turn into a problem.
it's like they're waiting for the right moment to strike. So keeping our animals strong and healthy is really important.
It is, absolutely. It helps protect them from even these sneaky, opportunistic germs.
Now, the book also talks about something called carrier animals.
Oh, yes, carriers. Have you ever seen this? An animal seems perfectly fine, but then others around it start getting sick.
Yes, sometimes.
That could be a carrier. An animal that's carrying the disease, but doesn't show any signs of being sick itself.
It's like a silent spreader, so it's spreading the disease without even looking sick. And then there are vectors too, right?
Right, vectors. Think of those pesky creatures we all know and love: fleas, ticks, mosquitoes.
Those are everywhere, especially during the monsoon.
Exactly. These vectors can pick up a disease from one animal and carry it to another.
Like little flying needles spreading the sickness around.
A good way to put it. They act like a bridge, spreading the disease without even getting sick themselves.
Now, the book uses some bigger words too, words like etiology, diagnosis, and prognosis.
Yes, but don't let the words scare you. Etiology is just a fancy way of asking, what causes the disease and how does it spread?
So it's about understanding where it comes from and how it gets around. Diagnosis is figuring out exactly what disease it is.
Right, like, is it a fever? Is it a stomach problem? What exactly are we dealing with? And prognosis is looking ahead.
Like, what can we expect to happen?
Exactly. Will the animal get better on its own, or is it a serious situation?
It's about understanding the possible outcomes. The book also talks about morbidity and mortality.
Yes, these are important for understanding how a disease affects our animals. Morbidity tells us how many animals in a group get sick.
So, if many animals are falling sick, it means the disease is spreading quickly.
Right. And mortality tells us how many animals die from the disease.
So a high mortality rate means the disease is very dangerous, even deadly.
Exactly.
Those are things we definitely need to pay attention to. Then there are acute and chronic diseases. What's the difference?
Think of it this way. An acute disease comes on quickly and doesn't last very long.
It's like a sudden storm. It comes in strong but passes quickly.
A chronic disease, on the other hand, develops slowly and can last for a long time.
More like a lingering illness that just doesn't seem to go away.
Right. And finally, we have local and systemic diseases.
Okay, what are those?
A local disease affects only one part of the body, like a wound that gets infected.
So it's contained to one spot.
A systemic disease affects the whole body,
So it's more widespread.
Exactly. Like a high fever, that's a sign of a systemic infection because it affects the whole body.
So understanding these basic terms gives us a good foundation for talking about specific diseases.
It does.
Now, let's talk about the different types of diseases that we might see in our animals here in Sharkhand. We hear that term a lot.
Yes. And these are the ones caused by those tiny living things we talked about earlier. Bacteria, viruses, fungi, parasites.
So the tiny invaders. The important thing to remember is that these diseases can spread.
Yes, they can spread from one animal to another. But not all infectious diseases spread by just touching each other.
Oh, so there are different ways they can spread.
Exactly. Some spread through the air, like when an animal coughs, or through contaminated food or water.
So we need to be careful even if animals aren't directly touching each other.
Right.
Then there are non-infectious diseases. These are the ones that don't spread from one animal to another.
Right. They're not caused by those contagious germs.
Okay, so infectious can spread, non-infectious cannot. Then the book mentions contagious diseases. What's the difference between that and just infectious?
It's a bit tricky. Contagious diseases are actually a type of infectious disease, but they spread very easily through direct contact.
So like touching a sick animal.
Exactly. Or even indirect contact, like sharing a water trough that a sick animal used.
So all contagious diseases are infectious, but not all infectious diseases are contagious. It's like a subcategory.
You got it.
And then there's a really important type we need to be aware of, zoonotic diseases. That sounds a bit scary.
These are the ones that can spread between animals and humans. Example of rabies.
So it's not just a risk to our animals, but to us as well.
Exactly. We need to be extra careful if an animal is acting strangely or seems sick.
We have to protect ourselves too. All right, next up, parasitic diseases. These are the ones caused by worms, ticks, those sorts of things, right?
Right. Parasites are organisms that live on or inside another animal and feed off of them.
So they're basically stealing nutrients from our animals.
You could say that. And they can cause a lot of problems. There are internal parasites, like worms in the stomach or lungs.
And external parasites, like ticks and mites on the skin.
Exactly. Both can make our animals weak and sick. And then there are deficiency diseases. These happen when animals don't get enough of certain nutrients in their feed.
So it's about the quality of their food.
Exactly. The book mentions examples like rickets, where young animals' bones become weak, and goiter, which is a swelling in the neck because of a problem with the thyroid gland.
So if they're not getting enough of the right things in their diet, they can develop these problems.
Exactly. So we have to pay attention to what they're eating, especially during times when the grazing isn't so good.
Makes sense. Next up, metabolic diseases. What are those all about?
These are diseases that happen because of problems with how the body processes food and uses energy.
So it's like the body's internal machinery isn't working properly.
A good way to put it. One example is milk fever in cows after they give birth. It happens because of a sudden drop in calcium levels in their blood.
Yes, we've seen that. Then we have poisoning. That's pretty self-explanatory. It's when an animal eats something it shouldn't.
Right. The book mentions poisonous plants as an example. We need to be careful about what's growing in our grazing areas.
And sometimes even too much of a certain type of feed can cause problems.
It can. And lastly, we have miscellaneous troubles.
Miscellaneous troubles. That sounds like a catch-all category.
It is. It's for things like bloating or problems with the uterus after giving birth.
So basically any other health problems that don't fit neatly into the other categories.
Exactly. So understanding these different types of diseases gives us a broader picture of the challenges we might face.
Okay, so we've covered the different types of diseases. Now, how do these disease-causing things actually get into an animal's body?
Well, there are a few ways. One common route is through what they eat and drink.
Makes sense. So contaminated feed and water.
Right. The book gives the example of anthrax. The spores of that bacteria can live in the soil for years.
So they could pick it up just from grazing.
Exactly. Another common route is through breathing.
So like when we get a cold from someone coughing?
Very similar. The book mentions tuberculosis and FMD as examples of diseases that can spread through the air.
Then there's entry through the skin.
Right. If the skin is broken, even from a small wound, pathogens can get in.
The example they give is trypanosomiasis, which is spread by certain flies.
Exactly. And they can also enter through the eyes.
Really? Through the eyes?
It sounds strange, but yes. Brucellosis is one that could be spread this way.
I never would have thought of that. And then there's the urogenital tract, which is basically the reproductive system.
Right. Trichomoniasis is an example of a disease that can be spread through mating.
And then there's the umbilicus, the belly button.
Right. If the umbilical cord doesn't heal properly, that can become a way for infections to get in.
So we need to be extra careful with newborn animals.
Absolutely. Cleanliness is key. And then there's the placenta.
The placenta. How can diseases be transmitted that way?
Well, the placenta is how a mother nourishes her developing baby inside her. But some diseases, like TB and brucellosis, can actually cross the placenta and infect the baby before it's even born.
So the mother could pass the disease to her offspring even before birth. That's worrying. And finally, there's the mammary gland, the udder.
Right. Infections can enter through the teats, leading to mastitis, which is a painful inflammation of the udder.
So knowing how these diseases can enter the body is really important for prevention. We can take steps to block those entry points.
Absolutely.
Now, how do we know if an animal is sick? What signs should we be looking for?
Well, the first thing to pay attention to is their behavior. A healthy animal is usually active and alert.
They're engaged with their surroundings.
Right. But a sick animal might be quiet, lethargic, not interacting with the others.
Maybe standing off by itself, head down, not interested in anything.
Exactly. They might even seem a bit depressed.
Makes sense. Just like us, when we're sick, we don't feel like doing much.
Right. Another important sign is loss of appetite.
So if they're not eating as much as usual, that's a red flag.
It is. Especially for cattle and buffalo, if you notice they're not chewing their cud, that's a sign something's wrong.
But before we jump to conclusions, we should always check that the feed itself is good, right?
You're absolutely right. Sometimes the problem isn't with the animal, but with the food they're being given.
Good point. What about their skin? Can that tell us anything?
Yes, healthy skin is usually smooth and soft. But if an animal is sick, their skin might become rough or dry.
Or maybe lose its elasticity, so if you pinch it, it doesn't bounce back as quickly.
Right. And their coat can also give us clues. A healthy coat is shiny and smooth, but if it's dull, rough, or standing on end, that could be a sign of illness.
Or if there are patches of hair loss, that could mean they're rubbing themselves because of parasites.
Exactly. Now, the muzzles should normally be moist. If it's dry, especially along with other signs like fever, it's a concern.
And what about their nostrils?
Those should be clean and free of any discharge. If there's any pus or crusting, it could be a sign of a respiratory problem.
Okay, so we've covered behavior, skin, coat, muzzle, nostrils. Now let's talk about body temperature.
Just like humans, a higher than normal body temperature in an animal is often a sign of infection.
So how do we know if they have a fever? Do we need a thermometer?
Ideally, yes, a thermometer would be best. The book gives us some normal temperature ranges for different animals.
Okay, what are those ranges?
For cattle, it's around 101.5 degrees Fahrenheit. For buffalo, it can vary a bit with the season, somewhere between 98.3 degrees Fair in winter to 103 degrees air in summer.
So that's a pretty wide range for buffalo.
It is. For sheep, it's around 102 degrees air, goats around 103 degrees air, and pigs around 102 degrees air. So if their temperature is much higher than this, they probably have a fever.
Even without a thermometer, we might notice other signs of fever, right?
Exactly. A dry muzzle, rapid breathing, the animal feeling hot to the touch, those are all potential indicators.
What about their pulse rate, their heartbeat? How can we check that?
You can feel the pulse in different places depending on the animal. For cattle and buffalo, it's usually easiest under the tail.
Okay, under the tail. And for sheep and goats?
You can usually feel it on their lower jaw or on the inside of their back leg. And that same spot on the back leg works for pigs too.
So we can check their heartbeat just by feeling for the pulse. What's a normal pulse rate?
For cattle, it's about 60 to 80 beats per minute. For buffalo, it's a bit slower, around 40 to 50. For sheep and goats, it's faster, 70 to 90. And for pigs, it's around 60 to 100.
So it varies depending on the animal. And of course, younger animals and pregnant animals will have a faster heartbeat.
They will. A pulse that's much faster or slower than these ranges could be a problem. And their breathing, that's important too.
Yes, we can tell a lot from how they're breathing.
Right. You can watch how their sides move or feel their breath coming from their nose. Normal breathing should be smooth and effortless.
So what are the normal breathing rates for different animals?
For cattle, it's around 10 to 30 breaths per minute. Buffalo, 15 to 20. Sheep, 10 to 20. Goats, 25 to 35. And pigs, 10 to 20.
So again, it varies.
It does. If you notice any unusual noises like coughing, whistling, or sneezing, those are signs of a respiratory problem.
Or if their breathing is very rapid or labored, that's also a concern.
Exactly. Now let's talk about the eyes. Healthy eyes should be bright and clear with no discharge.
What if their eyes look sunk or watery or stuck shut?
Those are all signs of possible illness. And sometimes the whites of the eyes can turn yellowish, which can indicate a liver problem.
What about their dung, their manure? What should that look like?
Normal dung for cattle and buffalo is semi-solid and greenish with no blood or unusual gas. For sheep and goats, it's usually in the form of small pellets.
So what should we be concerned about?
Look for constipation, where the manure is very hard, or diarrhea, where it's very watery. Also, blood or a lot of gas in the manure could mean serious problems.
Okay, makes sense. And what about their urine?
Normal urine should be clear and a light straw color.
So if it's very dark or bloody, that's not good.
Exactly. It could indicate problems with their urinary system. And for female animals, check for any discharge from the vulva.
Okay, so no discharge is normal.
Right. Any pus or unusual discharge could be a sign of an infection in the reproductive tract.
And finally, for milking animals, we should pay close attention to their milk.
Absolutely. Any changes in the amount of milk produced or its quality could be a sign of illness.
Like a swollen udder or blood in the milk, or flakes or clots.
Right. Those are all signs of a potential problem. So being observant is really key. We need to know what's normal for our animals so we can spot anything unusual.
It's about noticing those subtle changes.
Exactly. Early detection is so important.
Now, let's talk about some specific diseases. Let's start with anthrax. It sounds pretty scary, and it says it can affect all kinds of farm animals and even humans.
Yes, anthrax is a very serious disease. It's caused by bacteria that can live in the soil for a very long time.
So an animal could get it just from grazing in a contaminated field.
Exactly. And it can also enter through wounds or even through breathing.
What are the signs of anthrax?
Well, sometimes sudden death is the first sign. There might not be any other noticeable symptoms before the animal dies. Other times you might see a high fever and swelling, especially around the neck. And another sign is dark, tarry blood that doesn't clot properly.
That sounds terrifying. What can we do to prevent it?
Vaccination is really important. It's usually done annually before the rainy season. And if an animal dies suddenly and you suspect anthrax, it's crucial not to open the body.
Don't touch it.
Right. Report it to the animal health authorities immediately. They'll advise you on how to dispose of the body safely.
And that usually involves burning or burying it very deeply with lime.
Exactly. To prevent those spores from spreading.
Okay, that's anthrax. What about black quarter? Some people call it blackleg. It says it mainly affects cattle and buffalo.
Yes. Black quarter is caused by bacteria that live in the soil and can enter through even small wounds. It often happens during the rainy season. The bacteria that cause it are actually often present in healthy animals, but they only become a problem when the animal's immune system is weakened.
So when they're stressed.
Exactly. Stress can come from things like changes in weather, transportation, poor nutrition.
So the bacteria are kind of lying dormant, waiting for the animal to become weak.
Right. And then they take advantage.
What are the signs of this one?
High fever, difficulty breathing. Sometimes they'll make a grunting sound, and swelling in the neck and throat, which can make it hard for them to swallow.
And it can be fatal quickly, too.
Unfortunately, yes. So prevention is really about minimizing stress on our animals, especially during the monsoon.
Keeping them healthy and strong.
Exactly. And vaccination is important, too, before the rains start.
Okay. Moving on to brucellosis, also known as contagious abortion. It sounds like this one affects pregnancies.
Yes, brucellosis is caused by bacteria, and it mainly affects cattle and buffalo. And as the name suggests, it can cause abortions in pregnant animals.
That's heartbreaking.
It is. Usually the abortions happen later in the pregnancy.
Are there any other signs we should watch for?
Well, sometimes there might be stillbirths, or the calves might be born weak.
And the book says that this one can also spread to humans.
Right, it's another zoonotic disease, so we need to be very careful.
What can we do to prevent it?
Prevention is really key with brucellosis. Vaccinating female calves at a young age is very important.
And the book also mentions something about blood tests.
Yes, sometimes blood tests are used to identify infected animals so they can be removed from the herd to prevent further spread.
Okay, next on the list is swine erysipelas, or diamond skin disease. This one affects pigs.
Right. Swine erysipelas is a bacterial infection that can cause a few different problems. Sometimes it comes on very suddenly with a high fever, loss of appetite, and the pig might not want to move.
Then there's a rash, right?
Yes, often you'll see a diamond-shaped rash on their skin, which can be reddish or purplish.
Hence the name diamond skin disease.
Exactly. And they might also have swollen joints, making them lame.
What about prevention?
Good hygiene in the pigsty is really important, and vaccination is also recommended for pigs older than 3 months.
Okay, and the last bacterial disease on this list is enterotoxemia, or pulpy kidney disease. It says it mainly affects sheep.
Right. Enterotoxemia is caused by bacteria in the gut that produce toxins.
Toxins.
Yes, poisonous substances.
And what triggers this?
It often happens when there's a sudden change in diet, like if they're suddenly given a lot of rich feed or grain.
So we need to be careful about making sudden changes to their diet.
We do. And unfortunately with this disease, often the first sign is finding a seemingly healthy animal dead.
That's always hard.
It is. Sometimes they might show signs of excitement or incoordination before they die, but often it's very sudden.
So what's the best way to prevent it?
Vaccination is the most effective way to protect sheep, especially young lambs, from enterotoxemia.
Okay, so those are the main bacterial diseases to be aware of. Now let's talk about viral diseases. First up is foot and mouth disease, or FMD. This is a very contagious one, right?
It is. FMD can spread extremely easily between cattle, buffalo, sheep, goats, and pigs.
So it affects all of our main livestock.
It does. It
Yeah.
spreads through direct contact, through the air, even through contaminated objects.
So it can be tough to control.
It can. And the signs are pretty clear. You'll see blisters in the mouth, on the tongue, on the hooves, even on the teats,
Blisters everywhere.
pretty much.
Yeah.
And the animals will drool a lot, smack their lips, have trouble walking because of the blisters on their feet.
It sounds really painful.
It is. It makes them very uncomfortable and can lead to a lot of weight loss, reduced milk production, and other problems.
What can we do about it?
Prevention is key. Regular vaccination is essential. And if there's an outbreak, quarantine is really important to try and contain it.
And good hygiene.
Absolutely. We need to disinfect anything that might have come into contact with infected animals.
Okay, next up is pox. It says it can affect all farm animals, and some types can even spread to humans.
Right. Pox causes skin lesions like blisters and scabs on different parts of the body.
Sores and scabs, that doesn't sound good.
It's not. The way it spreads depends on the type of pox virus, but it can be through direct contact, through the air, or even through insects.
So it's important to isolate infected animals.
It is. And vaccination is available for some types of pox to help prevent it.
Next is hog cholera, which thankfully only affects pigs.
Right. Hog cholera or classical swine fever is a very serious disease that can be fatal for pigs.
How does it spread?
It spreads through contact with infected pigs, contaminated feed and water, even contaminated equipment.
What are the signs to watch for?
High fever, loss of appetite, weakness, bleeding under the skin. They might also have diarrhea, vomiting, and even problems with their nervous system.
So it affects them in a lot of ways.
It does. Vaccination is really important for preventing hog cholera.
Okay. Now, the next one listed is rinderpest, and it's described as a cattle plague. That sounds bad.
Rinderpest was a terrible disease. It caused fever, mouth sores, severe diarrhea. It was very deadly for cattle and buffalo. But there's good news.
Oh, good. What's that?
Rinderpest has been completely eradicated worldwide. It's the first animal disease to ever be wiped out.
Wow, that's incredible. So no more rinderpest.
No more rinderpest, thanks to a global effort involving vaccination and other control measures.
That's something to celebrate. Next, we have swine flu.
Right. Swine flu is a respiratory disease in pigs caused by influenza viruses, similar to the flu we get.
So like the human flu, but for pigs.
Exactly. And it spreads easily through the air, through contact on contaminated surfaces.
And what are the signs?
They're similar to human flu, too. Coughing, sneezing, fever, runny nose.
So basically, they just feel unwell.
They do. Usually it runs its course in about a week, and there's no specific treatment.
So we just need to make sure they're comfortable and keep them separated from healthy pigs.
Exactly. And there are vaccines available for some strains of swine flu to help prevent outbreaks.
Okay. And finally, we have peste des petits ruminants, or PPR. It sounds like a mouthful.
It is a bit of a mouthful. It's often called goat plague, and it affects mainly goats and sheep, especially young ones.
How does it spread?
Mainly through close contact and through secretions like nasal discharge and saliva.
So it's very contagious.
It is. Some of the signs are high fever, mouth sores, severe diarrhea, discharge from the nose and eyes.
And it can be fatal.
It can, especially for young animals. There's no specific treatment, but supportive care is important.
And there's a vaccine.
Yes, fortunately there is a vaccine to help prevent PPR.
Okay, that covers the main viral diseases. Now let's move on to diseases caused by protozoa. The first one is babesiosis, also called cattle tick fever. It affects cattle and buffalo.
Right, babesiosis is caused by tiny parasites that infect red blood cells.
And these parasites are transmitted by ticks, right?
Exactly. When an infected tick bites an animal, it transmits the parasite into their bloodstream.
What are the signs?
Well, you might see weakness, fever, loss of appetite, paleness, They might also have jaundice, which is a yellowing of the skin and eyes. And one characteristic sign is dark red or brown urine.
So there are a few things to watch for.
There are. And it can be pretty serious, even fatal, especially in young animals.
What about prevention?
Tick control is really important. You can use acaricides, which are chemicals that kill ticks, and treating infected animals with specific drugs can also help.
The next one is thalariasis, also known as East Coast fever, and it says it particularly affects crossbred and exotic breeds of cattle.
Yes, thalariasis is another tick-borne disease. It causes a range of symptoms, including high fever, swollen lymph nodes, loss of appetite, weakness.
So some similar signs to babesiosis.
Some overlap, yes. You might also see discharge from the eyes and nose, red or brown urine, and jaundice.
And prevention.
Again, tick control is crucial, and treatment involves specific drugs to kill the parasite.
Next up is trypanosomiasis. It says it can affect cattle, buffalo, and sometimes